These are the atypical antipsychotics. The main ones used are risperidone and clozapine. Atypical antipsychotics are mainly used to treat schizophrenia and bipolar mania. It also is used to help aggression and psychosis. It treats positive and negative symptoms in schizophrenia. A positive adds to your experience, such as an hallucination. A negative detracts from your experience, such as apathy. Atypical antipsychotics work by mimicking dopamine to block dopamine receptors. This decreases the utilization of brain dopamine, causing a reduction in positive symptoms. What makes the drug atypical is it also is a serotonin 5-HT2A antagonist.
Atypical antipsychotics can be taken orally as a pill or dissolvable with or without food. Risperidone can also be administered as an IM injection every 2 weeks. Therapeutic effect takes several weeks, so patients often stay on their oral medications. Atypical antipsychotics have metabolic side effects, so patients' weight should be monitored regularly, as well as their glucose, cholesterol, and lipid levels. Extrapyramidal symptoms are less common, but clients should still be aware of these symptoms. Due to risk of agranulocytosis, patients taking clozapine should be aware that blood cell levels need to be checked regularly.
Some of the main side effects include anticholinergic effects, nausea, GI upset, skin rash, photosensitivity, and hormonal effects. Patients are at higher risk for metabolic symptoms such as weight gain and diabetes. Patients on clozapine are at risk for agranulocytosis. Patients are at low risk for EPS, which is loss of voluntary muscle movement. Atypical antipsychotics are contraindicated in hypersensitive, comatose, or severely depressed patients. They are also contraindicated in elderly patients with dementia-related psychosis, and use them cautiously with a patient with cardiovascular disease, diabetes, or at risk for seizures.
Patients should avoid drinking caffeine when taking antipsychotics, especially clozapine. Caffeine can increase the amount of medication in the blood and cause more severe side effects. Patients should avoid drinking alcohol with antipsychotics. Do not take with immunosuppressant medications, opioids, tricyclic antidepressants, and antihistamines.
Monitor patients taking atypical antipsychotics for a lowered seizure threshold and photosensitivity. You should monitor their WBC levels, any evidence of EPS, tardive dyskinesia, neuroleptic malignant syndrome, or hyperglycemia. Monitor the patient's weight gain as well as their activity, sedation, or weakness or fatigue. To evaluate the effectiveness of the atypical antipsychotic, the client should have trust in their caretaker, have manageable anxiety, and can cope when anxiety begins to arise. The client should also have overcome any delusional thoughts, is not easily agitated, and is able to interact with others appropriately.